Hello?
Hello, this is Wes.
Hey, Wes, good.
Oh, only we can hear each other, huh? But we can't hear anything else.
Is that Kelsey?
Oh, there. Now I think I can hear somebody else.
Kelsey and Wes, is that you guys?
And Natalie Allen is.
I'm here. This is Wes.
Natalie.
And Natalie, are you on GoToMeeting?
I'm on the phone. I'm driving, so I have to listen on a phone today.
Okay. All right. And Wes, are you talking through GoToMeeting or through the Vernal Room?
So I'm through the app on my phone right now.
You're also GoToMeeting. Okay.
So I can see your presentation view, but I don't see any faces or anything.
Okay. Okay. That's maybe what you get today, but we're glad to hear from you guys. Do you see anyone else on them?
Yeah, there's quite a few people on it.
Okay. Can they hear you?
Yep.
Okay. All right. Bits of progress. So let's go ahead and start with our welcome, our introductions, etc. See, I'm not in PowerPoint, so I got to do that. I lost my mouse. I'm serious, I've lost my mouse.
So it's actually on this computer, and I think it's because it's treating this as a second computer.
Where is it on this
It's
computer?
on the right screen
There we
down the
go.
middle of the agenda.
I got a big glare here. I can't see it. Okay, I can use arrows. Very good. All right. So I think most people know this stuff. Bathrooms are kind of in the middle of the building. Walk down this hall, and I think you'll find them. Feel free to go anytime that you need to. I don't know if you're going to get guest Wi-Fi on the Blue Zone network today, but that's what you would look for. And we'll probably need to try and promptly end at 9:59. But again, that's because of the room technology that's not working today. So we'll just play it by ear. Okay, so there's been a lot of kind of uncertainty about what we were going to do for our meeting next month because it conflicts with this big transition summit. So we made the decision that we're not going to hold UCCCN next month, just FYI. Ahead of the introductions, didn't I? I'll pop back to that. So for those of you who are able to join us at the Eccles outpatient building near Primary Children's on November 20th, that we would love that to happen. And so hopefully everybody in this group on our mailing list got that invitation. And if you didn't, please let me know. I'll make sure and send another one out. It is an all-day meeting. You don't have to attend all day. It does start relatively early. I think you need to be bodies in seats by 8 a.m. But I think it should be really interesting. The agenda is shaping up nicely, and that more detailed agenda will go out soon. So hopefully you can consider that as your option for November 20th. Otherwise, don't come here and have a few hours that morning to yourself. Okay, so let's go back to the welcome and introductions. I just skipped right over that screen. For those of you who don't know, I am Mindy Tueller, and I facilitate this meeting usually more smoothly than this morning. And I manage the Medical Home Portal, and we'll be looking at that a little bit more in this meeting today as well. And then let's go ahead and have the people on GoToMeeting either let you know who they are and you can say for us, or have them go ahead and unmute themselves and talk.
So I'm Linnea Bauer with the Medical Home Portal. I work mainly with our partners. So I'm going to go through the GoToMeeting people. Erin?
She doesn't usually say anything. She kind of is just in the back.
I'm on.
Hi, Erin. Erin's taking
Hi.
So Erin's also from the Medical Home Portal team. Gwen, I know you introduced yourself in the chat. Do you have audio?
Can you hear me?
Yes, we can.
All right. Good morning.
Do you want to introduce yourself?
I'm Gwen Anderson. I'm in Price right now, and I'm with Eric's team for children with special healthcare needs and integrated services.
Great, thanks. James? James, if you don't have audio, if you want to just send a chat to introduce yourself. we'll keep going. Kelsey?
Hi, I'm Kelsey, care coordinator with Eric's team in Blanding.
Great. Linda?
Hi, I'm Linda, care coordinator with Integrated Services in Richfield.
Natalie?
I'm Natalie Allen. Oh, maybe you're not talking to me. I'm on the phone. I'm Natalie Allen, and I'm nurse practitioner for Integrated Services.
We were talking to you. Tony?
Hi, I'm Tony Estrada with the Integrated Services Program in the Ogden office.
Wes?
Hi, this is Wes. I'm a care coordinator for the ISP program in Vernal at Tri-County Health Department.
All right, and anyone else who didn't introduce themselves?
Can you tell who James? No, okay. All right.
IHC, it looks like.
Okay. All right, and then we'll just maybe start, Sharon, sorry if I put you on the spot. We'll start with Sharon and go around.
Sharon, I work with Rainbow Kids as the nurse care coordinator.
Angie McClellan, Disease Management and Behavioral Health for Alpine Pediatrics.
I'm Walt with Integrated Services Program with the State Health Department.
Good morning, Eric Christensen. I am the program manager for Integrated Services with Utah Department of Health Maternal Child Health Bureau.
So all those people on the phone who said, I'm with Eric's team, that's Eric.
I'm Heather Medhome with Wasatch Pediatrics in Draper. I'm Patricia Palau, and I'm a parent support specialist through Help Me Grow Utah County United Way, not Salt Lake.
I'm Heidi Bates. I'm the nurse care manager for the University of Utah Redwood Clinic.
I'm Rebecca Barker. I'm the transitionist with Primary Children's Connector Service Program.
We are happy to see you here, Becca, in your new role.
Thank you.
That you're still coming. We're pleased about that.
My name is Katie, and I am the new Becca. I'm the new care coordinator up at the University Pediatric Clinic.
Welcome. Welcome.
I'm Tay Haynes with the Resources for the Medical Home Portal.
Gina Solomoni from the Utah Family Voices and Utah Parent Center, and also part of the Medical Home Portal.
Thank you, better Utah Valley Pediatrics, the Provo office. I'm a care coordinator.
Jeanette Tingy, I'm Utah Valley Pediatrics care coordinator for Plaza Office of Utah Valley.
UVP is well represented today. Wonderful. Okay.
I'm Cassie Crane. I'm the care coordinator at Wasatch Pediatrics South Point.
And I'm Liliana Reese, manager at the Southwest Children's Clinic.
Excellent. Wonderful. Okay, and our main presenter is here, so I put you on the spot now, if you don't mind.
That's fine. I'm Christina Cho. I recognize a few of your names, and I'm sorry if you recognize mine from so many emails. I am the lead of Project Echo at the University of Utah, and I'm here to talk about Pediatrics Tele-Echo, which is my baby so much. So I'm excited to chat with you about it and get your thoughts.
Great. Okay. All right. We'll jump back into the announcements, and I'll pick up kind of where I left off about this transition summit. So again, it is on Wednesday, November 20th, and you are all invited if this is something of interest to you and your organization. Others in your organization are invited as well. So these times are a bit approximate, but I would say again, 8 o'clock will be the firm start time for the meeting, and 3 maybe 2:30 is when the working groups in the afternoon will wrap up. So if you're interested in being a part of those, that's the second part of the meeting. To that end, they're still kind of putting the fine details together, but one of the things that they're interested in doing is kind of taking a look at what's happening locally with regard to transition to adult medical care for children and young adults and adolescents transitioning. And we'd really like to make sure that primary care is represented there. The folks who are putting this on are by their nature specialists. So that's kind of their focus. And Dr. Norland and I are trying to make sure that there is a bit more of a primary care focus in there as well. And so it looks like you're going to have a number of different groups who are going to do like a poster and maybe talk for about 5 minutes to say, you know, these are some things that we're experiencing, and maybe these are some wins that we've had. And we would love it if there would be a practice who might be willing to get up there and do something like that. We're going to flip it a little bit and recognize that there's probably more barriers that primary care practices are experiencing than wins. And I think that this could be really, really valuable to these folks because they need to hear and understand what care coordinators and primary care practices and others who are at more of that, you know, everyday level are experiencing as they try and help these families and these young people find the medical practitioners they need. So if somebody might feel up to that, I would love it if you would contact me. We would really like to support this, and it shouldn't feel scary. I hope it doesn't feel scary because this is kind of what everybody's going to be talking about. The fact that this is where we're starting, and this is where we want to get to. So there's a survey that goes along with this that you may have seen with those emails, and that's a baseline. This is a project that's going to go over time. So they want to see where we're at now and then see what progress we can make. And so this would be very helpful. So think about it and let me know. All right, so a few updates to the Medical Home Portal. We have updated our Child Life Services page and also our page about transitioning to college. We've also got some clinical content that's been updated. We've just added a brand new coding for developmental and mental health screening. In fact, we're doing a fair amount around coding. So you might find that interesting. It's in our For Physicians section, and I can show you that in a little bit. But this is particularly around this kind of diagnosis, this kind of issue, and this kind of screening. And we've also added a new page on self-injurious behavior, which is something that I think folks might see more than you'd think. Finally, we've just done an update to our spinal muscular atrophy diagnosis module and related pages. All right, well, this is the time when you guys get to, you know, bring up anything that's going on with you, and we can do a little networking, we can do a little crowdsourcing, we can do a little brainstorming. So if you've got any difficult cases that you'd like to talk about and maybe get a little help from the group on, if you have any new resources, we always love hearing those. If you'd like to do an update on a previous case and let us know how things are going, we love that. If you're doing any motivational interviewing or quality improvement, we love hearing about that. So I hope that GoToMeeting people won't feel that they can't as happy to look at the chat box if that's easier for you and read your chats, or unmute and feel free to talk, and then same goes for you guys in the room. The time is yours.
I guess I'm on GoToMeeting with some background.
Yeah.
Muted them.
Okay. Nothing. It's a little unusual. Nobody? I'm trying to think what I could mention. Well, I'm happy to show some of these new pages. Let's see if I can find. There, I found my mouse. So coding and billing. All right, so we plan on adding some more under this section. Some of it's already out there that we're just continuing to increase and improve, and then we'll move it here. But here's the new page around developmental and mental health screening. So it's definitely going to give you the ICD-10 codes, and we'll hopefully, you know, give you enough information that you can actually utilize this, or, you know, someone in your group, your office, can utilize this. And then I'll just show you, I think I can show you what else we've got on here. We've got coding and billing for care coordination. And then I think we've got one more that's being worked on right now that's just sort of an overall optimal coding for children and youth with special health care needs that'll be coming out. So check those out. And then the self-injurious behavior is under common issues. So this is a brand new page. Has anyone seen kids with self-injurious behavior? Yeah, okay. All right, did I give people enough time? Anybody have anything they want to share?
I just wanted to ask a question. We got kind of a roundabout referral yesterday from Dr. Bill Cosgrove for a youngster who's just here from Venezuela for 6 weeks. I don't know what the legal status is of the kiddo. I don't know if we have refugee status or if we have something else. It has been years and years since I did Medicaid eligibility, so 20 years ago. But back in the day, refugees got Medicaid for like their first 9 months to a year when they came to the country. Does anybody know if that is still the case?
Yeah, I work with the refugee population at Redwood. She should be affiliated with either AAU, American Asian Association, or CCS, Catholic Community Services, or IRC, which is the international. So she coming in, she should be affiliated with them. And then they do have certain timelines. Like the first 8 months, they get get refugee Medicaid, and then after that they have to apply for just normal traditional Medicaid. But if she's even as an asylee, they should be able to get help from one of those 3 agencies to get going.
And I didn't have enough information to really know, but I kind of want to have a few of my ducks in a row when we actually get the direct referral information. This was just Bill saying, we saw this kid and we're concerned. He's 6, nonverbal, child has autism. We need to get that diagnosed so we can get moving. They've got him enrolled in Granite School District in school already, but without that medical diagnosis for the autism, it's going to be a little bit tricky.
Yeah. And Division of Workforce Services also has a refugee coordinator that works with refugees coming in, and so they can help get services in place. And they also have refugee. I can't remember what it's called. Refugee Coalition. They have a group that works with refugees that have developmental delays, make sure they're getting integrated in. Now it's not it's not the best, but with the help we can kind of forward them where they need to go.
All right, sounds good. Thank you so much. I
Yeah,
appreciate that.
yeah, and I will send all the refugee information to you. And
thank you, Heidi.
That'll be good.
Excellent. Okay, good.
We also find that, I don't know if you we run into this a lot, but if they come from they are refugees, they go to a refugee camp. There's a lot of little kids that have lost their parents. So other family members or other people will adopt them. So they'll come over, and the original family unit is maybe a 4, but they've adopted 6 other kids. And so it's they're not really our kids, but they're just running around this refugee camp, and they need somebody. So we have a lot of families that have adopted these other kids, and when they get here, because we're who has guardianship? Apparently there is no adoption process course in the refugee camp. So when they get here, they are part of that family unit. They don't have to go through any adoption paperwork, nothing. They are just integrated into that family, which I found great, right? But also a little oh, okay. So
that's the opposite.
Yes.
More paperwork to get through TSA than that. So that's kind of interesting.
Yeah.
All right. No, thank you. I
Yes.
appreciate that information.
Oh,
I'll
wow.
send all the information out to them.
Heidi is a wealth of information.
Yeah, well, you kind of get at Redwood, that's that population and I love it, but it's
Challenging.
yes, yeah.
Okay. Oh, good. Okay. Great. Great. All right. Anybody else? All right. Well, I think that's okay because we're almost at 9, so we might as well go ahead and switch over to our main part of the meeting. And I'll find this page for Christina. And Christina, if you want to come on up. Got a little bit bigger. And hopefully you can find your mouse. The mouse is really small. There's a little bit of a weird zoom thing going on here. And I'll let you drive. And if you don't mind wearing that or holding it, that will be a little bit better audio. Okay.
You let me know if anyone says they can't hear me.
I will.
All right, so as I said, I'm Christina Choate. I'm the lead program coordinator, the person that oversees Project Echo at the University of Utah. On Monday, we are celebrating our 8th birthday. I'm very excited. I'm making cake this weekend. Project Echo is my passion. If you've seen my emails, again, I apologize. I love Project Echo so much. I really do believe in what it can do to help providers in the community, in our region, and globally. So Project Echo started in 2003 in New Mexico. We were the 3rd site to replicate, and now there are over 400 hubs globally. One of my favorite that is not at the University of Utah is in Ireland, I believe, and it's looking at type 1 diabetes, which I have. And there are a lot of different hubs looking at different disease states that impact their communities and ways to take that ivory tower and spread it out. So sharing resources for free, there's no cost to any of it, and allowing community providers to feel empowered and practicing at the top of their license. So that's the gist of ECHO. That's the philanthropical side of ECHO. But really, I'm here to talk to you about one program in particular that Dr. Diane Liu and I started in 2017. Got a little bit of a history. We submitted a proposal to the state to start a pediatrics tele-echo with a focus of 5 conditions. And though we didn't get that, we got funding elsewhere to launch a 1-year echo for 2 health conditions. And for any of you who participated in our program last year, that was pediatric behavioral health and autism. I know Natalie Allen is on the call, and I hope Natalie is cheering me on right now. Thank you so much for being on the call. Has anyone else? Heidi?
You know what, Christina, this is Natalie, and people need to, I am a faithful echo worshiper. You guys, it's such an amazing program that is free and so valuable. So thank you for all you guys do. It's awesome.
Thank you, Natalie, and thank you, Heidi. Is anyone else in the room? Did I miss you if you joined? Or if you've received my emails? Okay, well, you might receive my emails one day. And again, just know that I love ECHO so much, you can delete them if you need to. But I want to show you how you can gain access to our program if you're interested, and give you a few of the benefits of what ECHO can do and what we offer on our site. So this is our Project ECHO website. I can email it out to the group after. I do see it is tricky, huh? Yeah. I can email it out. There it is. Out to the group after today's meeting if you're interested. This is the main site. We are one of the franchises of over the 400. So if you ever see one of these echoes, just know that we're all collegial. You're welcome to join any other echo that you see that really interests you or has a really good echo hub. For example, if you're interested in endocrinology, that's not something that we do here, but Nevada has one that's terrific. So I can always connect you to one that would suit your needs. To join Project ECHO after the end of my presentation, if I have swooned you, you can click the register for Project ECHO button and let me know which echoes you're interested in, and I'll show you which ones we offer. Again, I'm going to go mostly over Peds Echo today, but just know that we have 6 echoes currently running, and we're happy for you to join any of those. So I'm going to scroll to that part. Echo is my baby. We have an adult behavioral health program that we run every Thursday. That one's wonderful as well. Right now we're in substance use disorders, and then we'll be transitioning into mood and anxiety disorders, which is something obviously we see all the time. And then from there, we'll be hopping into social work, crisis and diversion. and we'll be doing psychosis and clinical psychopharmacology. So if you know anyone who's interested in these topics, feel free to send it their way. Again, it's free. There's CME and there's contact hours for most of the programs. So we do offer that for those who are interested. We have a burn soft tissue injury echo today on, I'm not going to go into the topic. It's pretty gnarly, but we also have a GI and liver care, a Hep C, and a pregnancy care echo outside of the one that I'm going to dive into today. All of the resources for these programs are online. All of the slides we've done, all of the session recordings we've done, any handout that the provider thought was really important for people to know about, all on our website. So if you walk away from anything today or with anything today, just check out the website, scroll around and see if you find something that you like. Similar to the home portal. So let's go into Peds Echo, the baby. So this program, or this web page has quite a few things for you to know about. One is the submit a case button. For those of you in the room, after I talk a little bit about Peds Echo, I don't want to talk the whole time. I want to get your thoughts on our case presentation form and see where our form maybe doesn't meet your needs and where we can get you something that would work better. But the submitting a case button is really the meat of Echo. A lot of our newer echoes start out really didactic focused. So the idea is having one of our specialists at the University of Utah on a panel. We all do all of this through Zoom, and I'll show you what it looks like in a second. So they're on the panel, they're talking about something they're really passionate about or something within their specialty or something that we've heard from the community that they need. For example, Dr. Diane Liu today is going to be discussing HPV vaccination, and we're having some survivors on the call to talk about their experience. So they're on the call talking about their experience. And then the rest of the time is really devoted to cases, similar to what you guys just had when the room was silent. We get that too, trust me. Natalie knows what that's like. So we're asking for cases because that's really how we feel people learn best. Talking about their experience, saying out loud what went well, what didn't go well, what resources they have available, and honestly, what resources aren't available. We can preach all day about the best practices on X, Y, and Z, but if you don't have those resources in your community, what are you going to do? So we want to hear from you on, listen, that is not feasible in our community. I can't do that. What do I do instead? And that's what we did in our autism module quite a bit. So you can see here that our program through the academic year, we take a break for summer because we all need that, right? The program is divided into 2 modules. We're in adolescent health right now, so we will be discussing transition to adult care at the end of that module. And then we're going into specialty recommendations in primary care. So right now we're collecting those topics that people really care about in their primary care services or in their clinics. So for example, I'm working hard on trying to figure out type 1 diabetes transition to adult care. That's something I'm really passionate about and how we can fit that into the module. So if you are interested in participating with us, you can either register on the main page, or I've made it easy for you. You can also click the sign up button here, and that goes directly to me, so I know who you are and I can get you all the resources you need. So you can click that sign up button and join us. This is the meat of our program. If you're ever wondering what we're going to be talking about throughout the year, you can look at our schedule. You can join us for one session. You can join us for all the sessions. I'm not going to call Natalie out too much, but she has joined us for most of the sessions, which has been great. I do share all of the PowerPoint slides from our faculty on here. That might be a little boring to just read, so I also share the session recordings. And again, I'm going to use one of those session recordings to show you what it looks like, so it's a little less intimidating. But if you've ever done a Zoom call where you can see like the Hollywood squares on the screen and you can chime in when you want via chat or unmute your microphone, it's essentially that. So we make it welcoming. It's over lunchtime, so feel free to eat your salad or sit there and do charts if you need to. I totally understand. We are all spread thin these days. You can have your camera on or camera off, though I'm probably going to pressure you to turn it on. We have all of our stuff from last year as well. So this is everything that we did on mental health, and below that is all the things that Dr. Carbone did with the autism module, all the session recordings, and all of the PowerPoint slides. So again, if you're ever thinking, I know that we did something on self-injurious behavior as well. If you're wanting to go back and look to see what Dr. Paul Carbone has to say about that, or any of his faculty, you can go back and watch the videos. They're anywhere from 15 minutes to an hour long. So you can take a look. And then the fun part for me is all of the resources that our faculty have shared, similar to the medical home portal, and that we just have a website where we're sharing what we find pertinent. I broke it down by module, so you can see all of the screening tools or checklists, or I think there's a sample IEP letter in there, differentiating between a medical and educational diagnosis for autism, all of those things that we talked about in our modules. And then you can see our clinical team right now for the adolescent health module. So that is our website. That is the plethora of information that I am in every day. Peds Echo is held every Wednesday from noon to 1. I understand that some people are busy during that time. So again, I have session recordings for if you want to go back and look at any of those videos. If you participate live, you do get the benefit of the Q&A and the cases that are discussed. I do not record the cases portion for good reason, right? So when you're watching those session recordings, just understand that that is the didactic portion only. We do encourage cases on the call though. It's all HIPAA compliant. I promise all the software is HIPAA compliant, and that case form on the top, the submit a case button, ask only the pertinent questions that we would need to make an informed decision as a specialist. The care to stay in your hands when you submit a case to us to discuss on the call. It's a learning environment for everybody. Everyone can learn from that case. There's no dumb question, I promise you. It's really an opportunity just to discuss what happened and then allow people on the call to chime in and say, that happened to me last week. Let me tell you what I did. And then allow our specialists the opportunity to chime in with what they would do from their seats, which may be completely different from what you would do, I understand. And then you get a written statement from that specialist as well for you to take back. This works really well in our hepatitis C echo because there are healthcare providers in the state that can't treat hep C without that specialist looking over their shoulder in a way. And our echo actually serves as that. So you can be a nurse practitioner at the Redwood Clinic and treat hep C by submitting a case to Dr. Terry Box via echo, getting the recommendations from him, and then submitting that to insurance. So ECHO has really proven to be a really great tool for our healthcare providers in the state and our region, and we're pretty proud of it. We've actually just hit 3,500 cases since we started, which is a lot of good care delivered. I'm trying to think through what we need before I discuss cases. Does anyone have any questions before I hop into the form about how to access this or?
Are you going to forward it today so that we can sign up?
So today like I said, we have the session on HPV vaccination with Dr. Diane Liu, and then we're going to go into early onset psychosis with Chris Rich. He was also involved last year in our pediatric behavioral health module. So he's coming back for more, and we're very grateful. If you have any topics that you think are really important that we missed, we don't build this because we think it's important. We build it because you think it's important. I've never built an echo that didn't come from the community first, just because if I build it, I went to school in Iowa, but I promise you if you build it, they do not come. So I really do think that your input is the most important thing for our program to be successful, because it is for you. I don't make money off of this echo. You're not submitting a case and us getting paid for that. We're funded completely through the University of Utah Medical Group. They believe that their faculty should be involved in educational opportunities in the community. And so they support the faculty to do that. And I'm staffed completely through the University of Utah as well. So we do receive grants, and this program is funded by the Sorensen Legacy Foundation, which is wonderful, and we're very grateful for that. But this is really just a community resource for all of you. And I promise it's not gimmicky. If you can only join 15 minutes of it, we'd love for you to join. But our mission is education at the University of Utah. And I believe strongly in that if we kind of cut that ivory tower down and deliver education in the community where they feel it's best, and it doesn't matter where a patient lives, they will get the same level of care no matter what. And that's our mission. So I am going to go into the case form, and we can talk a little bit about it. A lot of it is medical. And that's why I want to talk today, to see where I could be missing the mark for folks who are going to be more willing to present a case, but take a look at this form and say, that's not anything for me. I will say that if you have something that you want to bring to the group and you don't want to fill out this form because it's not meeting your needs, you can email me the information that you'd like with the PHI, and I'll take it from there. And then we'll be able to discuss it on the call. I just add it to the agenda to make sure that we don't forget about it and to make sure that we give it enough time to discuss. So that's ultimately all that's for. And if you give me enough information about the case, no name, you don't even have to give me birth date, just give me age and the gender, sex, and then go in there on a little paragraph about what you're dealing with. I will submit that to the mentor team. They'll take a look and start writing their recommendations. Because ultimately, I want to be able to give you something to walk away with so you can think about it and decide whether or not it's for you. Again, it's all in your hands from there. So let's take a look at it. This is the REDCap form. REDCap is completely HIPAA compliant, so anything you put in here would be safe, though I will say that if you put a patient's name, I'm going to have to go in and delete it. So sticking to just a general case form is really important on letting us know what's going on, how old they are, what's their social situation, is there anything we need to know about so that the specialist can, or the general pediatrician can make an informed decision on what's happening. We've got information about their grade, who they're living with, if you know that. And then why are you presenting this case? So oftentimes, you think about it, a lot of these sessions are attended by pediatricians. There are pediatricians in the community. In fact, I've got one individual in, I keep mentioning her, Natalie might laugh, but in Jackson, Dr. Karen Klee, she's been joining a lot as well. It's just her and a nurse in a clinic, and she is very honest about the amount of time that she has to put into a quality improvement project or the amount of time that she has to submit a case. Really frankly, the amount of time she has to join the ECHO, but she does. And so most likely you're looking at pediatricians looking to submit cases, but I want to make sure that I can meet the mark for you guys as well. So you're looking at why are you presenting this case, whether you're confirming a diagnosis such as autism, or you're looking at a mental health need, or maybe you're needing help with transition of care for a patient. And then really all of this is for you to tell your story. You could put 5 words in there, you can put 500 words. I think there's a limit, honestly, but whatever you feel will give the physician on our end or the case manager on our end a really informed decision or informed story about this patient. Again, no need for names or anything like that, just what you think are the relevant details. And then if you have anything you'd like to input, such as a chart review or something with didactic information, you can attach that as well. So everything is here for you to submit for our Wednesday sessions. If you want it for that next session, you're submitting on a Tuesday and you want it for tomorrow, I will 100% put it on the agenda for you. It does not have to be relevant to the topic of the day. So if next week we're talking about onset psychosis, don't worry about submitting a psychosis case. You can submit something on anxiety. You know, I've tried this medication, and this medication, or this patient came in and has these 10 medications on their chart. I don't know what to do. Where do I start? Please feel free to submit it any week. We're happy to take it. So Dr. Diane Liu is a general pediatrician. You guys know Dr. Diane Liu, right? Right. She'll be reviewing the cases as well as the other faculty members that she'll pull in depending on what the case is. So we have a really good crew of folks involved who are just really generally excited about education and want to just know better what we're dealing with in the community and where we can be helpful. This is a collaboration with UPIC. I saw the UPIC logos everywhere. We also use that logo everywhere, which is wonderful. So this is a collaboration with UPIC, and it's a quality improvement project for those who are willing to take that extra step. Gabby is heavily involved in the program on the quality improvement side, and I'm the one who's involved in the more the programmatic side. So the two of us tackle this with Dr. Diane Liu and just really love education. It sounds so kitschy, but I promise it's not. So does anyone have any questions or comments on how I can make this more accessible for you?
Just wondering, I guess I didn't notice if, do you have a agenda list or do you have a list on there that will show what's coming up for the next week? If it did, I missed that.
No, that's a great question. It is right here on what topics we're looking at for the next few weeks. Agenda emails. So if you sign up for ECHO, Heidi, you know this. If you sign up for ECHO, you're going to get 2 emails from me a week. You might get 3 if I'm sending a newsletter for the month, but I promise the newsletter is nice. You'll get to see what other things we're doing in that month. But you're going to get 2 emails from me a week. You can totally delete them, I understand. But one is a case call saying it's time to submit your case if you have one. The reason I do that is because I have a timeline on my end that I have to get it to the physician in time. You guys would understand if you were given a case last minute before you show up into a meeting, it's harder to make an informed decision. So they ask that they see him at least a day in advance before the session so they can read it at night. Dr. Box reads his Hep C cases every Thursday night in bed before he hits the sheets. So a lot of our physicians are doing this outside of their academic time. And then you'll also get an agenda email from me on Tuesdays. And that says what's coming up the next day, what's the connection info, how can you join via phone versus your computer or from your Polycom, what's the CME code, all that information that you would need so that you can join the session. And if you're interested, I can also send you a calendar invite so that it's on your calendar already and you're good to go. It has the connection information on it. So you can just delete my emails, and when Wednesday shows up, click the link and you're in. The CME and nurse contact hours, I promise, are free. All it takes to get the nurse contact hours after participating with us is to click the link and tell me what you learned. It's a requirement from our office. It helps us understand too whether or not that was impactful or not. We've certainly had sessions where it's really impactful for a physician, but probably not for a nurse, and we understand. So hearing what you learned or what you didn't learn is important for us. And then for CME, you can call in, hit the digit code, and you're done. So I promise that joining should be easy. But if any of it is not, that is my job to make sure that it is a little bit more easy or easier. Is there any other questions or thoughts on the program? Yes.
So see if we had a mental health patient that we're really struggling with, and like we've tried medications in Utah County, mental health is a big.
Yeah.
Yep. So we could submit case notes, the doctor or care coordinator could be on the call, and then they would like look at the case ahead of time and be able to give feedback and offer recommendations over that call.
That's right.
Without like patient name or just say, why don't you try this, or how about this, or they'd be willing to.
Yeah, and even if the person on the call presenting the case can only be there for the 10 to 15 minutes for that, that's fine. We understand some people are, you know, I had a meeting in community clinics not too long ago where people said to me, like, this sounds wonderful, but I am catching up on charts at lunch and then I need to go home after work. And I totally understand. So if there's that time constraint and people really need help and they see this forum as beneficial to them, then we want you to take advantage of it. The case, like I said, cases can be relevant or not relevant to what we're talking about that day. We just want to be a weekly, consistent opportunity for you to get education and also try to see how a specialist or how another person on the call would see that case. It's fairly interesting when we talk prescriptions. Sometimes what comes up is this patient can't afford it. And sometimes that happens with Hep C, right? Hep C drugs are incredibly expensive. And pharmacists will chime in and have their thoughts on, well, have you tried Costco? Things like very relevant information to the normal population versus thinking just the specialty mind. So feel free to submit any cases you have.
So if you submit a case, but you can't be in on the meeting, do you respond to those cases through email or?
That's a good question. Typically no, and our medical director strongly believes that more information will always come out on the call than what's written. And the specialists often don't feel comfortable without hearing the voice of the provider or the care coordinator, whatever it may be, giving that information. The specialist or the recommender will always ask questions that will eke out a little bit more information that they find relevant. So we think it's important to do it that way. If there's an absolute need and it's like, I'm sorry, but I'm struggling, then that's something I would go through Dr. Diane Liu on the side. So if that is something that's needed, you can let us know and I'll figure it out, but it wouldn't be through ECHO. Just to protect us, we have our legal responsibilities that we have to meet. We are very HIPAA compliant for many reasons that you guys can understand. And having that opportunity for everybody to learn on the calls is our favorite way. But I understand your question. Does anybody find the case-based learning useful in this room? I know you do it in this forum. Would you feel comfortable on a call if you only knew maybe 1 or 2 other people? Maybe? Okay. You don't have to show your face, so it does help. A lot of the people, on the call who are submitting cases will show their face just because it's that face-to-face, like, thank you for your help, kind of eye-to-eye consultation, right? But again, if you're on the phone, like Natalie Allen's driving in, right? If you're on the phone and you just say, I've got this really difficult case that came in yesterday and I'm struggling. If it really does need to be on the fly, understandable. If you'd be willing to the next day fill out the form for me so that we can have it on our records, it helps us with grants. You can understand, I'm sure. Then that would be wonderful. But again, if you just have a question on the fly as you're driving in and you think, wait a second, this reminds me of that patient I saw last week. Please chime in and share your information with us, and we will do the same. I think this is so much fun, but again, I'm making a cake for their birthday, so you can probably guess why I do this job. I love meeting the community where they are. I don't particularly love when specialists preach and say what they would do without considering the impact on the community or what resources are available. I think that that's just doing a disservice to our patients in those communities. I love hearing people on the call who are in Price and Vernal and Blanding. Those are a lot of the communities we serve as well. It's in St. George. Last year, we trained 176 healthcare providers. We were in 10 states, and we were able to really deliver solid best practice recommendations both ways in those communities. So you will see people on the call from Pennsylvania, from Idaho, Washington, Wyoming, Idaho, Montana, all of those places. But the majority, 73%, are from Utah. So they're practicing where you are as well. Some of them probably just down the street. And if you've joined them in anything with UPIC, you'll probably see them on the call, because we do have quite a few people from UPIC who are willing to join. Katie, I know Katie. I recognize these names. Yes.
Christina, can you hear me?
Yes.
This is Chuck Norland. I'm on the web. You mentioned the Hep C program and the case-based, credit that people get. I assume that that's how you logged 3,500 cases.
Yes.
You get anywhere close to that on the other programs in terms of the numbers of cases being discussed?
Hep C is so unique. Hep C was the first echo ever started. This echo model really was based on Hep C. If you ever watch one of our Hep C echoes, I encourage you to join one if you're curious. You can always, when you register, click the Hep C button. Dr. Box can get through 20 cases in an hour, which is incredible. A lot of these providers, the first time they join, they're a little nervous. They'll present the case, but each time they join, they learn and they learn and they learn. So we now have folks at Odyssey House presenting cases. They're focusing on addiction medicine, but they see folks with Hep C. They'll present these cases, and it takes them about 2 minutes to present. They already have their own recommendations in mind. They know what's best. They tell Dr. Box, 8 weeks of Harvoni. What do you say, Dr. Box? He says, thumbs up, and they move on to the next case. So much different model than Peds Echo. If you're going to present an early onset psychosis case, there's no way that's happening in 2 minutes. It's not that easy. Oftentimes our behavioral health cases will take anywhere from 10 to 30 minutes, depending on really how much relevant information there is and really how long the provider wants to spend on that case, the presenting provider. So most of those cases, 2,000 of the 3,500 are Hep C. And we hope, we're digging into the data now, but we're looking at how many patients we've helped cure through that. We're very excited about a lot of the data that we're able to share with the states.
Yeah, I've long thought that the hepatitis C was the ideal condition for an echo program because it is fairly circumscribed. It's expensive, but time limited if you treat it right, and so it's like the ideal. Whereas particularly pediatric mental health is much more complex, not so circumscribed, and no necessary endpoints. Much more challenging. And connecting, I'm sure you connect with other echo programs around the country. Are there any other conditions that have found anywhere close to hepatitis C's uptake?
Yes, tuberculosis in other countries has done quite well as well. So TB echoes are quite popular, and HCV, HIV echoes also are similar in that model.
Right.
So say any infectious diseases where there is an endpoint usually are those really quick case-based echoes. The way echo is moving, however, for sustainability purposes, and Dr. Norland, I'm sure you can understand this, is into quality improvement.
Right.
And the AAP is a super hub for echo, so they train other hubs how to run pediatrics echoes. They run their own echoes. I know they've done one on epilepsy before. Those are really focused on quality improvement. So how can we help with efficiency in the clinic, especially when you're looking at just, one pediatrician and a nurse or a care coordinator and all of that. So Hep C and all of those infectious disease echoes, quite different than those quality improvement echoes. And I don't know if you've heard about the autism echo in Missouri.
I don't.
It's, I think Paul Carbone will be helping them now moving forward. It's a really exciting quality improvement echo that was the basis for them getting state funding for all of their echo programs in the state. So
when you say it's focused on quality improvement, that means that it's part of a quality improvement project. So there's a time frame and people are more or less required to attend. Is that?
Yeah, each echo hub is different. We're open enrollment for all of ours because we understand some people only want to join one or two or maybe all. But
Right.
for some of those echoes, it's closed enrollment. They sign people up for the quality improvement portion. They're getting those who are really willing to take the extra step and get that MO Part 4, which we offer in our echo as well. So each echo hub will run differently, even though we're all part of that bigger franchise.
Got it. Okay. Thank you very much.
Yeah. You had a question?
Well, it's more administrative, but you've got like 6 topics?
Yes.
And how are they weekly or all?
Yeah, for the most part. So we have 2 that are bi-weekly. We have 3 that are weekly. And then we have 1 that's 6 times a year. That's our burn and soft tissue injury echo. That one's little different. Last time we focused on self-immolation. Those topics are just a little different than a lot of our other echoes. They're more case reviews. You're not going to have a self-immolation in the moment. So those case reviews allow people on the call to talk about, how EMS was involved, how the fire department was involved, how the hospitals and clinics were involved, how the post-care is involved. But the rest are weekly. So our Hep C is weekly, 20 cases a week. GI and liver care. Pregnancy care is every other week, and then peds and behavioral health are every week. And it's that consistency. It just allows people to join.
Balls in the air for you to keep.
Yeah, it's fun. If I didn't love it, it would probably be a bear. But it's terrific to have healthcare providers on the call really benefiting, going back to their communities, talking to other physicians or other healthcare providers about what they're doing with echo. We took one of our healthcare providers who's participated in Hep C echo for a few years now. She's a nurse practitioner at Greenwood. And despite continued pressure for her to spend time on other things, she's treated a lot of patients with Hep C and cured them. So we took her to Washington, D.C. to talk about her experience with legislators. And we submitted hate to use the word, I'm a former lobbyist, so I can't say lobby, but we kindly asked our legislators to sign on to a letter to the Secretary of Health and Human Services that asks them to evaluate Medicaid and Medicare payment models and how echo can fit into that. This is not sustainable for the rest of my life, right? Getting funding from the University of Utah, we're a legacy item right now. The day will come where they will find another program, I'm sure, that will meet need. And so really trying to figure out how we can continue to meet need in communities, but find sustainability through Medicare and Medicaid. Some other echo hubs have done quite well with that. So there's a lot of balls in the air, not just on making sure the echoes run, but also trying to figure out how we can really be seen as care delivery in these communities. We're not directly involved with the patient's care, but we're helping that healthcare provider practice at the top of their license so that they can take on more And I know everyone hates to take on more, I get that, but really be more efficient. Instead of looking up something for an hour and trying to figure out the best practices, it's at their fingertips. Or they listened to that echo last week and they know the answer right away. So, any other thoughts or questions? I would love for you guys to join, even if it's just for one, and it's not for you, I understand. It's a time commitment. An hour is quite a bit of time. If you can only join for 10 or 15 minutes, that is absolutely okay. But if you have feedback after joining and you think that this could really be taken to the next step with X, Y, or Z, I am completely open to that feedback. Again, we build these with you in mind. And at the end of the day, I want to go back to my leadership and be able to say that we met need in these areas.
So do they discuss the topics in general, or are they just going over cases the whole entire time?
They discuss the best practices, the gold standard, as well as what actually happens for the most part with that didactic. Lasts about 20 minutes. They'll go longer if we don't have any cases, but often what you'll see, and this is what Dr. Nikki did last week, she infused a case into her presentation. So we talked about marijuana use and obesity in a patient that had been submitted to us. The provider was not able to join the call, so we discussed the case kind of as an example of how to talk about substance use with a teenager, and how to also discuss obesity, and just a lot of it is that practical knowledge, right? Like, what are you actually going to say versus what are people telling you to say? And what resources do you have available for parents? And how are you going to help them transition to college? Are they looking into college? Things like that. So we actually had a case discussion in the middle of the didactic last week from our presenter. So whether it's from the community or from the presenter, we're really hoping to discuss a practical case at the table.
Yeah, one more. How are they with follow-up? So you bring a case, you discuss it, then are they good with like a month later? It's either, hey, not going well, can we discuss it again? Or hey, going great, can we talk about it? Like an ongoing.
Yeah, it's ongoing as long as you want. So in the case of Hep C, I'll use that as an example. We've often had patients, maybe not now because Hep C treatment's getting easier, but in the past, we usually had around 4 follow-ups for each patient just to make sure things are going well. We wanted to talk about Hep A and B vaccinations. We wanted to talk about the interferon years with mental health concerns, those kinds of things. So you could follow up a patient as much as you want. You will get the written recommendations within about 48 hours, I'd say. So whatever you hear on the call, you can write down and take with you right away. Again, we're not necessarily directly impacting that patient care. We're just helping you try to think through it. But then you'll get written recommendations with our statements and all of that. You can put them in the patient chart. You can do whatever you'd like with them just to show you did an echo consult. And then if you want to bring that back next week, you want to bring it back a month later after they've come in for a session or for a clinic visit, or you get a phone call from a parent and you're thinking, holy crap, what do I do now? Bring it to echo again. We'll bring the first case. I'll print it for our faculty member and say, this was day 1. This is where we are now. What's happened in between and where do we think it'll go from here? All of that is stored in REDCap. So luckily, if anything's presented, we have all of the data. I think there were some concerns, especially with autism, about where this data is going, who sees it. I see the REDCap data. Our faculty sees the REDCap data, meaning Dr. Diane Liu, to review the case. Otherwise, it's stored in there. I'm not printing it and sending it to Medicaid. I'm not doing anything with it other than storing it for our own purposes. We have our own liability and make sure that that stays within our own house, our ECHO team.
You mentioned documenting that you had an, that a provider would document that they've, had an echo consult. How do you typically see people doing that? And in
that's a good question.
What context?
So that's a really good question. When I first started back in 2017, one of my first meetings I went to was how to integrate this into Epic. And it was kind of a nightmare, I'll be honest. There is no integration into Epic right now. So I'm not sure how people have done it other than back in my days of Epic, uploading the document and putting it into the other category as an echo consult. I would defer to your clinic on what you think is best. For submitting for any insurance purposes, we haven't had that with Peds Echo yet, though we're certainly happy to kind of walk you through that as the first case happens. But most of the time, what I've seen, if it's going to be like an anxiety or depression medication that we're talking about, you're probably not going to need that aside from only storing it for your own records. You're not going to need to submit it to insurance or anything. And then if anything gets beyond that, most of the time they're probably going to say, this is a perfect instance for referring to your nearest center for X. Never say refer to us. That doesn't make any sense. If you're all the way down south and you can't refer to us, we understand. So that echo consult, I'm sure, could be used for that referral. Like we got this information from the University of Utah that it's probably time to refer to X. We're wondering if you would take this echo consult as that. I'm sure that would.
Just kind of mentioned in summary, not necessarily.
Yeah, we don't have any coding or billing for it. That would help sustain us, right? But no, we don't. We don't take funding from providers or industry or anything like that to sustain our echoes. That's part of the echo model, for better or for worse, for sustainability purposes. But again, it's not seen as us teaching you on how to do X and then you referring to us. That's a legal issue. So it's really just whatever you feel is best for that care beyond what we give you. If we tell you to refer to an autism specialist, you can send it to whoever you want that you feel is comfortable with that. And you can decide not to take our recommendations, but at least you'll have record that this is what was recommended by somebody, and then you can get a second opinion.
So with Help Me Grow, we do a lot of like networking breakfasts with healthcare providers. So I definitely plan on sharing this bit with them.
Great. Yeah.
But we also do a lot of parent supporting and sending informational resources that are reliable, reputable.
Yeah.
What are your, I guess, opinions on sending these links to parents? Is it just very medically minded, or is it not parent friendly? What are your thoughts?
It's a good question. I've thought through this question quite a bit because this is the only echo that we have where I honestly think parents will seek out information and want to see what healthcare providers are thinking versus Hep C, where I don't think a patient is going to go look to see what Dr. Box is saying about Harboni. I think it's healthcare friendly. I think it's medically healthcare friendly. I do think that what we say really is that healthcare providers' opinion and backing it with research and best practice and gold standards of care. But at the end of the day, anything can be seen as not appropriate level of care by a parent, or maybe that their case is different than the one we're talking about on the call. So I would say it's probably not parent friendly, but we do have resources on here for healthcare providers to give to parents. So, that would just be cutting the middleman a bit. I do know we have like the best relaxation app for kids with anxiety, things like that, where parents might find those resources wonderful. It would just be typically the healthcare provider watching our session would see that and then would be able to give it to their kids as they come in, or say, the University of Utah says that this is a really great tool. Would you be willing to try it? We have the 13 best books for helping children with anxiety. Again, these were just resources mentioned on calls, either from participants or from our faculty as things that they use in clinic. I remember Paul Carbone was talking about in a clinic when they're doing an assessment, what toys or what sensory items that they have around the room. And people on the call were like, okay, I get it, sensory items, but which sensory items? Like, what are we talking about here? Can you send me the Amazon link? I'll buy it right now. So some of those things are on here so that people can go and just take a look at what was recommended. It's not me getting any money from Amazon, I promise. So it's a long answer to some of it is relevant, but then weeding through it might be tricky. So it's probably more for healthcare providers. Yeah.
going to jump in here because I think this is a good segue. So
Yes.
I think you can keep that because I'm
you
going
got
to be asking you questions.
Okay.
So we knew that Christina's part of this meeting would probably just take the first, half an hour or whatever. We've done a little bit more than that because you guys have been so engaged and that's what we were hoping for. But one of the questions that we thought we'd sort of turn the tables a little bit because a question that came up as we were planning this meeting is, well, are these sessions and cases, do they get into some of the maybe less medical things that we talk about so much in here? And so I think this is, kind of a perfect segue. If you've got the mental health case that's come in, sometimes the things that might be able to help that family quickly might be less, medication driven or identify the type of therapy that would really be best suited, and more about what do I do tomorrow for this kid, and is there a sensory place? Is there, something more like that? So I don't have a perfect idea in my head of how to explain this, but it would be very much more practical and a lot, less maybe something that a specialist would know about. Do those things come up? How are they handled? Are there good resources? Clearly, sometimes there are, right? Things like an Amazon link for an item that get overnight and would help that child.
Yeah.
But how much a part of that are these cases and are these sessions?
It depends on if we have the case submitted in time.
Okay.
If we get the case and we see the question coming in that is not necessarily relevant for the Paul Cup to the world, and we get someone else on the call who can understand this case from your point of view, then that's what we would do. It's typically that we're more likely to see something come in from a pediatrician who says, here are the vitals, this is what we saw last week, and here are their medications, where do I go from here? And that's really what that case form was built for. But again, and that's gonna go to the Diane Luz of the world. So if you submit a case with enough time for me to do my due diligence to go in and find someone who can help with this, I promise I will.
So I think what we'd like to do is offer to you that this group and the Medical Home Portal really are oftentimes about just those kinds of things.
Yes.
So if we could be a resource for you, you've got a nice conduit to us now through Gabby. So guys, Gabby works for Diane. That's the UPIC connection there. Gabby's a little bit new to all of this.
Yep.
And she's
it was Dawn last year.
Okay, Dawn. All right. And so she would probably need to maybe go to this group, but we have a listserv, and again, if there's time, we could help perhaps with some of that brainstorming.
Sure.
We just recognize that sometimes those are the things that can be, pretty pivotal in a case. In addition, of course, to those best practices and that bigger medical picture, which is crucial as well.
Yeah, the medical picture will always somewhat prevail on these echo calls because those are the things that you can easily submit in a case form, right? You fill in the temperature for the patient and their height and weight, and that's, in a lot of ways, those are going to prevail on these case forms. But I'll tell you, with our pregnancy care echo, we get a lot of questions that are not relevant for the MFMs of the world. They're more relevant about midwifery questions and things like that. So they'll submit cases a little differently than our OBGYNs will. And then for Peds Echo, it is so multidisciplinary. It is not just pediatricians, I promise. Like I said, Natalie's been joining us, Heidi's been joining us. So we also get school nurses on the call. And I'm still working on getting out their questions because they're from a way different perspective, right? They're listening to some of these talks, very medical, and they're thinking questions that they have, but it's not necessarily relevant to that medical side. So I really do welcome different types of questions and different ways of thinking about the case. It is not just bullet point 1, bullet point 2, bullet point 3, what would you do? Sometimes cases are much more complicated. Our behavioral health echo runs completely like that because our mentor truly believes in the multidisciplinary side of things, which is why we embed our LCSWs into our echo for every echo that we have. So please bring your questions and do not be shy about asking questions that are not necessarily Seroquel she's been on Seroquel for this many years. What do I do now? Just bring your perspective. I would love to hear it. Even if it's emailing me during the session or chatting me during the session, I have something to bring up. Can I bring it up now? Let me know when it's time to bring it up. I can coach you through it too. And I'm more than happy to do that. I'm happy to make it comfortable for you. That's the whole point.
We did get a chat comment from Jan Barker saying, I highly recommend the series to everyone, 2 exclamation points. So
thank you, Jan. I'm so glad you're on too. See, we got people on these calls. I know all these people's names, and I usually just email with them and see them on Echo, but it's nice to be able to put a context to where people are.
So how many of you think that noon to 1 on Wednesdays might be doable for you, or at least a portion of that for the case staff? Okay.
That's great.
Okay. All right, so let's just go back to that sign up link. Is it the Survey Monkey?
So we got 2.
We got 2.
I'm gonna just have, it depends on if you guys are interested in just peds or if you want to explore other echoes as well, like our adult behavioral health or something like that. It can be relevant for peds. But if you just go to our peds page, click that baby icon, the sign up button is here.
On your adult one, do you cover transitioning and all of that in there?
We can. You just would submit it to me and I find a slot for it.
Okay.
Yeah. So our schedule is, for the most part, booked out through the academic year, but we're ending in April. So typically when I get sessions where people have asked for something and really want it, I just push it out to beginning of May and get those sessions specifically in there for people. Or I'll just swap out a session and say, well, let's not do this one, let's do this one instead. So your input would be really important there. Dr. Paula Gibbs is the lead mentor for that program, and she's a wizard. I love working with her. She can get someone in that call pretty quick if you need that. So this is the sign up button for just the peds. Again, if you're not wanting to join Hep C or anything like that, I understand. This helps us try to figure out your context so that I understand who you are. So when you sign in and it just says Heidi, I almost 100% know it's Heidi Bates. So this helps me understand who you are when you're joining the calls and allows me to email you. That's honestly all it is. And then here, if you're interested in either of the modules, you can sign up for just one. You don't have to sign up for specialty recommendations in primary care if you don't want, or maybe you don't care about adolescent health, I'm not sure. And then whether or not you're interested in the quality improvement aspect with Gabby. They have really tried to make it known that it should not be intimidating, that they're going to meet you where you are in clinic. We talked about this on one of the early calls with Dr. Karen Klee. She said, I don't have time for a quality improvement project. I'm barely floating by as it is. It's me and a nurse. And they're going to meet her where she is on, I think, one screening tool. That's it. And they're going to do a quality improvement project on that for a few weeks and see how it goes from there. So if you're interested in any of that, just clicking the yes, I'd like to know more, just flags it for Gabby to know whether or not she can approach you and ask you about it.
Okay, so I have a couple more things, but now with the other echo, I'm thinking those people should come to the training.
Yeah.
I'll follow up. Yep. Okay, so there are a few topics coming up that
yes,
we thought we would just point out. Medical Portal has clinical information on those. So you've got, if you don't mind, I'll just switch over to. And if you feel like sitting down, you're welcome. I'm probably going to talk to you more though. So
you got it.
No. Okay.
I can. I'll just hang out.
Okay.
While Mindy's pulling this up, Jan says, I learn every time I see one.
Oh, thank you, Jan. I'm so grateful that you joined. We get a really good group of people on who are, I don't know if we just transition our excitement about Echo to other people or what it is, but we get such a good group on and they all get friendly with one another.
So it looks like there is depression and anxiety coming up. Is that right? Correct. Okay, so we've got modules on both of those. So
here's with Chris Rich and Lisa Giles.
Okay, cool. So we've got an anxiety disorders module, and we have depression one. I think the depression module was recently updated. So I just was going to take an opportunity quickly to remind this group what we do in our diagnosis modules. So these are, and Chuck, feel free to jump in. These are authored by experts, often University of Utah, primary children's experts that we know personally, and they all follow a structure. So every single one of our 54 diagnoses and conditions modules that you see here follow the same structure. That doesn't mean they all have the identical kinds of information because it's just what's appropriate and relevant. But they'll all be structured this way. So a description area, a clinical assessment area, and then a treatment and management area. And this is where we talk a little bit more about perhaps some of the things that would come up in an echo. So we include pearls and alerts that are often things that only experts know after they've seen a lot of kids with this kind of situation. And so those are put right up at the top. Sometimes they're pretty important to know. And then we talk about managing common problems with depression in this case. And then we go into what we call systems. And sometimes there's a lot of systems that show up under here. Other times there's less. So clearly mental health and behavior is going to be the big one, and then pharmacy and medications for depression. Another one of the topics that are coming up is ADHD. We've got a module on that. Another is childhood obesity, and it sounds like maybe Nikki did something recently on that as well.
She did.
Okay.
She did on last week. We talked about obesity trends and just talking about how we talk about eating with kids and the importance of that. And we're going to do another session on that. She was focusing it out specifically about the case that came in,
right,
regarding substance use, but we will go through it again.
Very good. Okay. And then there is a transition to adult care. And when was that again?
That's the final session in
January. Okay, we'll want to put that on our schedule for sure. So I'll make sure everybody is reminded about that one. Okay.
I'm especially interested in that.
Yeah.
Especially for folks with chronic diseases, it's very important to understand that transition and
Yes.
feel as though they know what they're getting themselves into. I remember when I was transitioning with my type 1 diabetes, I had no idea how to even call in for my pump supplies or how to call in for my insulin, just because all that was taken care of by my pediatrician for the most part and my mom. So learning all that before you go to college is key, right?
Right, it is, 100%.
Experience.
Yeah, oh, that's great. Okay, well, we have a champion then here who has fantastic.
Transition is so important.
Well, with insurance through age 26, we still do all that for my son, who's a
Yeah.
type 1 as well. So
Yeah.
one of these days we'll have to cut
A lot of-
the umbilical cord.
Then they realize how expensive insulin is and go, wait a second, this has been going on all this time. I remember the first time I got my bill for insulin and I thought, this is crap. I'm not doing this.
Yeah.
I actually worked for JDRF though, so for a while it was all also taken care of for free.
Fabulous. Okay, and I just have one more question for people, and you don't have to answer now. But granted, this is probably the first time you're seeing this case form, but I would be curious for some informal feedback whenever it's convenient for you. Would this be something, if we modified it for our purpose in UCCCN, that would be of value or interest? Is it one more thing that I'd be making you think about ahead of a meeting? Or would it help you to think about it in a different way and submit it ahead of time?
Let me ask you this, though. I know you put something out a month or two ago from someone who had a question about a case and it just went to the listserv, and all of these responses came in. Is there a way to kind of have an amalgam of, maybe something like this, that somebody could fill that out and say, I'm concerned about this patient, here are the pertinent pieces, and have something go out along those lines?
That is really interesting. So if we had that on the medical home portal and you could fill it out and then send it to the listserv, and then that sounds fascinating. Again, we just need to be super sure. Maybe we have it sent to me and then I take a quick look at it first and then send it out.
I think that would be wise.
Yeah.
Yeah.
Yeah, because the other thing is I don't know if I would want to wait a whole month to, when you fill it out and say, I've got this case, yada, 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 and then wait a whole month to talk about it.
Right.
I would like
No, I mean,
a little bit of answers.
did anyone feel like their inbox was getting hit hard on that day or so when we had that, or was it okay?
It was really fine. If you have nothing to offer, you don't respond, and if you do, you do respond, so.
Okay. So if you can see somebody else offer the same thing you would have, you're like, moving on, yeah.
I don't know about other people here, but I've always found that when we talk about a case like that, or, something here, it's just almost uncanny that within a couple of weeks, all of a sudden we get something similar or something came through and we all discussed it. So we kind of knew where to go and how to do it. But we've found that with our team, that happens all the time. Something's never come up, it comes up in here, all of a sudden we're hit with a case like that.
Okay, well, that's a good idea. You may have helped us to get on to something here, so.
Yeah, I'd say that question about why are you presenting it? What do you see as the problem and what do they see as the problem is just really the number one thing that we care about. So if any of the other stuff isn't relevant to you or you want to adopt that in this forum, just put a space in the white box and move on to the next one. It actually cheats the system a little bit.
It makes you wonder if you've been seeing that all along but didn't notice.
With spaces?
Oh, I think Keeney's what Eric was saying.
Oh, maybe. Interesting. All right, well, I think we'll probably give this a try. Okay, well, I think that's it as far as my questions were concerned. Anybody else have any more questions for Christina?
You said it ends in January?
So this module ends in January and then we'll.
Oh, okay. You're not ending in January.
No.
Okay.
We'll, it's an academic year. We give people a nice summer break to enjoy and kind of refresh a little bit. And we'll come back again in September next year, so.
And the registration gives us access to previous modules to peruse and see what's interesting. Is that right?
Okay. You have to register for that. So if you go back to that website, and let's say tonight you can't sleep and you want to go look at some of our session recordings or our PowerPoints, all of the stuff from last year is available here on the website, 2018, 2019 year. It's a free session recording or PowerPoint. And then all of the, let's say in the session, Dr. Carbone mentioned some resource that he recommends. I guarantee it's here. So it all kind of links together. The registration gives you access to this. And what that means is it gives you access to joining us live so that you can participate live like Jan, like Natalie, like Heidi, and be able to ask questions in the moment and say, this is actually really relevant to something I've been doing. I'd love your thoughts on it. Because the whole point is for it to be engaging, right? It's not a webinar. I try to count that. It's not a webinar. I hate the word webinar. It's so snoozy. It's really lifelong learning. So if you want to chime in, great. If you want to join for 10 minutes, great. Just participate at whatever level you'd like.
Having been a casual observer in one office over from Cynthia Palacios and Natalie,
yes.
They were enthusiastic every week on there. I heard questions going back and forth. What I liked is how it's very interactive. I mean, how many times have we logged into a webinar and you're on mute and you're multitasking and it's going on in the background? This just felt really interactive and like a lot of good exchange of valuable information. So
for better or for worse, it really is supposed to be engaging in what we, with our behavioral health echo in particular. I can think of so many times where our providers on the call, they're PC, but, or I mean our panelists at the mentor team, they're PC, but they say it how it is, and that's really what echo is supposed to be about. Like, this is what's real, this is what's feasible. I understand, like we have a provider who is based from one of the Indian reservations. Blanking. Anyways, he's able to tell me like, we don't even have a psychiatrist or a psychologist, and I don't know what to do with this patient. What do you recommend? The answer is not always referring. Sometimes the provider says, well, let's think about this. When's the patient coming in next? How can you prepare before it? When they come in, what's the number one topic you're going to focus on, and blah, blah, blah. So really we want to meet people where they are, and then we take information with us as well. The echo model, that spoke model, is essentially what it is. It's bi-directional. Like that's what I was saying earlier, that we're not just pushing information out and expecting people to adopt it, and then we wipe our hands clean and like pat ourselves on the back and say, whoa, we did it. We really delivered better healthcare in the community. The idea is that we're getting information from the community as well to say, maybe the way we've been approaching this issue hasn't quite been right because it's not feasible in Cambridge. So that's honestly the point of ECHO. Now, because Pete's ECHO is somewhat new, we're still in that phase of people being a little shy, and I understand, it's okay. Natalie's not shy, thank you, Natalie. But we're gonna start seeing more and more people on the call who will say out loud, like what's real and what's feasible and what's not. And we're hoping for more cases because that really just shows what people are actually seeing in the community versus what we think we're seeing in the community based on referral rates.
Well, we appreciate you giving up what is clearly very valuable time to come and talk to us today, Christina. Thank you so much, and thank you for what you're doing.
Yeah.
Amazing.
If anyone wants to join today's session, I hate to do this, but for the multiple people on the call, the Jans, the Natalie's, Heidi, if you guys would be willing to share the calendar invite if you have it, or maybe the agenda that was sent out yesterday for people who want to join today's call on HPV vaccination, please feel free. Otherwise, when you register, I'll get you on for the next session.
And I'll send out links to signing up and just the website overall before I leave this room today. So you'll have that in your inbox well before noon. Okay?
Thank you all.
All right.
Thank you.
I really appreciate it. And I will see you online. It's one of those Hollywood squares. Thank you all.
Thanks,
very
Christina.
much.
Okay, so guys, no meetings here next time. The next one will be December 18th in this room. Hopefully we'll have all our technical issues worked out. And then just again, I'll just throw out that on November 20th, we'll have that transition summit. And if there's a practice who'd be willing to take a few minutes and help us understand that you are actively working on transitioning patients to adult medical care, and here are the things you've experienced in a poster with 5 minutes, that would be hugely helpful, really. So, okay, thanks so much. Have a good rest of your day. Take some food. Bye, go to meeting, folks.
Hey, Mindy, I just want to give you kudos for being